Generally in surgery, we consider complications as 30-day complications, for example, in most patients. That's including both inpatient and outpatient complications. But there hasn't been a strong focus on that interval of care after patients go home. What really is happening in that post-discharge setting? They're sort of lumped together with just total complication rates. And so we've been very interested and focused on really targeting that window of time where patients are at home and having a better understanding of what really is going on, really, so we can figure out ways to improve it and develop initiatives and mechanisms in which we can take better care of patients and prevent those complications.
One of the perks of using such a large database is we were able to collectively have over 500,000 patients in our study cohort. And what we found was that median length of stay across all these procedures that were studied decreased by 1 day during the study period. We also found that, like similar to previous studies, post-operative complications decreased over time by about 1 to 2%. But the proportion of post-discharge complications increased by 12% from 2014 to 2019. It was definitely satisfying to see that this is the trend that we were thinking about, because this is the path that we want to take. And what we think our ultimate takeaway message is that there is a black hole that needs to be addressed between the time patient gets discharged from the hospital to their first post-operative visit.
One area, as described, would be to help with educating patients, educating their families, folks that are going to be taking care of them, their family and friends, prior to surgery and before they are discharged from the hospital, in order to equip them with the skills and self-management ability to recognize concerning signs and symptoms and know that, in fact, it is something that is a problem and should be discussed with their surgeon or surgical team. So that education piece, I think, is absolutely critical to safe surgery. The second piece, which we've all experienced a lot and has been, I think, even intensified even more in the era of COVID that we've just been through and are going through, is communication is so essential to providing high quality care to surgical patients.